Good morning, Leslie, and good morning to the viewers. And just a slight correction, it's not a government employees pension fund, it is government employees medical scheme. So to your question, the importance of having healthcare cover was demonstrated during COVID, as you mentioned. And the difficulty that is being faced by all of us is the challenges relating to, the economy. The family budgets are really taking a big strain, as we all know. And what is of importance is, for us not to deprioritize healthcare insurance. Rather, it remains a priority because the temptation when the budget is under strain is for people to look to what is normally regarded to as garage purchases to balance the budget. But I really would encourage that, those who are able to have access to medical schemes should ensure that they remain on medical schemes as best as possible, because you never know when you need your medical scheme.
So one of the national conversations in this space, particularly at government level, is the national health insurance. What's the progress on this initiative? And is this different from what GEMS is currently offering?
Yeah, the progress is there is a national health insurance bill that went through Parliament during 2022. And the stage at which it is that there were recommendations in the last sitting of the Parliamentary Portfolio Committee to make amendments to both the Medical Schemes Act and other legislation that needs to be changed before it can be ascended to the National Council of Provinces. The legislative process is quite long. So where we are, in a nutshell, we are in a legislative process. However, there is also other work that is being done by the National Department of Health to prepare. The biggest thing here is uncertainty around how long this will take. So to your second question, is it any different from what we are doing? Yeah, the National Health Insurance, it's a vehicle that the government will be using to try and achieve universal healthcare coverage. And universal healthcare coverage simply means that people should have access to equitable, quality healthcare, regardless of your ability to pay, which is not the case at the moment. At the moment, if you are able to afford a medical scheme, you have access to private hospitals. And then if you don't have a medical scheme, you have access to the public sector, which at the moment we know there are some challenges which we also hope are being addressed. Yeah. So a medical scheme at the moment gives you access to private healthcare insurance, health.
I don't know about our viewers listening and watching, but it's so convoluted and complex for me, just finding it difficult to understand. But yes, as you alluded earlier, the health insurance is a garage purchase. And when compounded by the electricity increases and other costs of living increases, how are your members taking your yearly increases, and do they have an option to exit?
They shouldn't exit at all costs. However, the annual increases are based on what their medical needs are predicted to be in the coming year. So in 2023, we have people called actuaries. They estimate how much utilization there will be by members of, in our case, of the government employee scheme. And when we make adjustments, which is the increases that you're talking, we are taking that into consideration. So in our instance, the adjustments was a 5% increase, which is below the CPI of about 7.4. It was around 7.4 by the end of the year last year. However, the impact on the members' pocket will be about 2%. And I hope I'm not talking anything complicated. And that is because government employees have got a subsidy. So they are subsidized by government, which reduces the impact on the pocket.
Those percentages still don't make sense to me, just in terms of government providing a 3% increase last year, but being expected to pay a 5% increase on your medical aid. do these actuaries to actually take this into consideration?
It is not what the actuaries want. It is what will cover the medical needs of the members of the scheme. A medical insurance, and in this case is us, GEMS, as a government employees medical scheme, would be failing in its responsibilities if they don't budget appropriately. So to try and explain the 5% and the 2% that I've spoken to you. So we pay claims overall, everything that we pay in the region of 40 billion every year to the various healthcare providers. So let's say it was 40 billion for last year. Because of the increases that the healthcare providers, the hospitals, the pathology labs will implement because of inflation in the coming year, if we collect 40 billion again for 2023, we will not be able to cover those expenses. So what we do, we adjust in anticipation of the increases that will be implemented by the people we pay, so that we cover the healthcare needs of the members. We pay for those adequately. So the 5% that I mentioned is after we had considered everything, including what we have in reserve. Yeah. Normally, actually, healthcare cover, inflation, it's much higher than the consumer price index. However, because of the reserves, taking something from the reserves, we were able to have an increase or an adjustment for the monthly contributions, which is below inflation. And then because government also subsidizes this medical schemes, the impact on the pocket of the government employees is only around 2%.
So, Dr. Moloabi, there's another process that's still underway in the medical schemes space. The preliminary findings of the Section 59 investigation that found that also your scheme and Met scheme racially profiled Black health professionals so that they do not enjoy the same benefits with other race health practitioners when claiming rendered health services. What's the latest here?
So there were interim findings, and maybe we shouldn't go into that because we don't have time in terms of those the allegations. We stress the allegations, those are interim findings. What we have done after the release of the interim report, we have been very upfront about the fact that we will look into what these interim findings say, and then we have engaged very extensively with the healthcare providers who raised these issues. I stress that these were interim findings to which we responded, but what we have done, we supported the process to start with, the Section 59 inquiry. We have already addressed the interim findings, and we have addressed we have been given a right of reply, which we have responded. So we are all waiting for the final report. However, most of the issues that the doctors were raising, we have engaged with them to address them. Suffice to say that, these interim findings, whether we agree with them or not, that's immaterial. The important thing is that our attitude was that if there are issues that people are raising, be sensitive and attend to them.
Have you made changes to the system, though, in the interim to ensure that something like this doesn't creep up again?
Well, the answer is we have looked at our process. The short answer is that we have looked at our processes. We have got standard procedures that we have said, this one needs improvement here and there. So there are definitely improvements we have done in terms of these matters that were being raised and the things that were causing discomfort in our interactions with the healthcare professionals.